Hello, everyone. John Lin here, and welcome to ExpertGate's exclusive interview series, where we bring you conversations with leaders shaping their fields. Today, we're honored to have Dr. Sandeep Reddy, a globally recognized expert in healthcare management, digital health, and transformative application of artificial intelligence in medicine. With over 25 years of experience across both academia and the healthcare industry, Dr. Reddy is currently a prolific author, a passionate advocate for safe and ethical AI integration in healthcare, and the visionary founder for the Center of Advancement of Translational AI in Medicine. Dr. Reddy's work has earned him international recognition, including being named a WHO digital health expert and a changemaker by HIMSS. Today, we'll dive into his journey, his innovative work, and how he's paving the way for a more equitable and AI driven healthcare future. Dr. Reddy, it's a pleasure to have you here. To start, could you share what inspired you to specialize in your field?
Thank you for having me here. My journey with AI has been quite serendipitous and quite long. Before I landed up in working on AI projects, I had a long career in medicine, academia, and working with the government and in consultancy. So, over the many decades of my work, I realized that technology plays a very important role in addressing many issues that health services and healthcare faces. And within technology, AI, artificial intelligence, is an important aspect. And we've already seen many studies and many applications that can benefit patients, clinicians, healthcare services. But what I'm particularly interested and fascinated about AI is its ability to be versatile and also improve access to healthcare. We know, not just in Australia, but across the world, people face issues in terms of accessing healthcare, both from a geographical point of view, but also from a financial point of view. I truly believe artificial intelligence can play a role. And utilizing my experience in medicine and research, working in the government, and working in other sectors. So I'm particularly fascinated about AI because of its versatility in being able to be applied in different aspects of medicine, but also in different aspects of healthcare, service planning and delivery. And an important part that really attracts me to AI is its ability to improve access to healthcare services. I previously mentioned the challenges healthcare services face and patients face in
Mm,
terms of accessing healthcare and delivering healthcare. So I feel like from that point of view, AI can play a very important role. And utilizing my diverse experience, I feel I can play a small contributor role within enablement of AI adoption within healthcare.
mm. I mean, thank you so much for that, Dr. Reddy. You've been a staunch advocate for improving healthcare outcomes through technology, through AI, and the versatility of its applications for an access to healthcare. Now I'd like to ask you, Dr. Reddy, how do you see your work creating a positive social impact, especially in these underprivileged communities or underserved industries?
Yeah, I come from a developing country context. I worked as a medical practitioner in very remote and rural contexts.
Mm,
So I really truly appreciate from the coal phase what it means to deliver medical care to vulnerable communities, under-resourced in under-resourced areas. So from that point of view, I have a very, very high confidence that AI as a technology, and because of its versatility, and because what we have seen already in research and in many applications, AI can narrow the gap between the health service delivery and where patients can't access the delivery. Let me give you an example.
Yes.
We've had for some years now telehealth, and now with the combination of artificial intelligence and telehealth, we can get rural and regional communities access specialized medical care that they wouldn't have been able to in the past without leaving where they resided.
Mm.
Now we have AI being able to utilize to identify anomalous skin lesions, AI being utilized, AI machine learning being able to utilize to analyze vital signs and identify different medical conditions, and AI also being used in the form of avatars to help with mental health counseling. And these are just few examples. There's so many examples that we can look
Mm.
into. But the point is that now we have that technology which can narrow that gap, if not completely close the gap,
Mm.
but to a considerable extent.
Oh, yes. I mean, that work with dealing with rural communities and providing them access to this kind of healthcare. I mean, of course, uh, it's not going to be completely filling the gap, like you mentioned, but it's a great leap forward in the right direction and in the right use of an application of AI. But now I'd like to ask Dr. Reddy. Now, what type of projects or collaborations then would you be most excited to explore through ExpertGate ourselves?
I think if you look at my diverse background, the best use of my expertise or my experience would be in education. I think an important step in AI adoption in healthcare is educating target communities, whether it's clinicians, whether it's patients, or important stakeholders who
Mm.
make decisions about adoption of AI. So, from that point of view, AI literacy plays a huge role because there's a lot of misconception about AI, about what AI can do and what AI cannot do.
Yes.
And this, apart from dispelling those misconceptions, but there's also an imperative on people who have that knowledge and expertise in AI to be able to educate the general community, but especially in healthcare, the important stakeholders about how to utilize AI safely, effectively, and to improve patient outcomes, but also narrow that gap between what healthcare services can offer and
Mm.
what patient communities need.
Oh, definitely, definitely. I mean, narrowing the gap is these days is more so important than ever. And with experts and like yourself, there's this kind of duty with when you're in the know to apply this broadly and make sure the leadership and the corporations and the industry they understand the importance of this and moving forward along with it. Now, talking about moving forward, now at ExpertGate, we dedicate 50% of all of our profits to developing curricula and initiatives focused on Industry 5.0, and this is to benefit underprivileged communities worldwide. Now, how can we enhance these efforts, Dr. Reddy, and what roles do you think universities and industries should play in amplifying their impact?
First of all, I would like to commend your institution in enabling that service to underprivileged communities. I think it's important for all institutions and the corporate sector in particular to be able to undertake that um, service, but also understand that the profits that they make or the business that they gain from the community has to be reciprocated. So,
Mm.
first of all, commend you. And to address your question about how we can enhance that efforts. I think I go back to that aspect about access and education.
Mm,
So we know that a lot of communities, even in well-performing health systems like here in Australia, don't necessarily receive healthcare in time, but also when they require it. And also the type of healthcare varies across urban and rural areas. So that variability is pretty important from a clinical point of view because it can
mm,
lead to not only inadequate healthcare, but also sometimes medical errors too.
mm.
So that aspect is really important. Then the other aspect I just discussed is the education aspect because it's not only clinicians who can benefit from that AI related education, but also patient communities and healthcare managers who will be either utilizing AI or will be enabling that adoption of AI to understand that. So, if to emphasize that importance, right now, people have been on the fence around AI for quite a bit because a large part of AI research and AI applications were restricted to particular hospitals or particular research sites
Mm.
or particular universities. But with the advent of generative AI, now theoretically anybody can access AI and utilize AI for their individual purposes. So there is a lot of interest around what AI can do. I think this is a moment where education would play an important role in ensuring that from a healthcare point of view, that people can understand what AI can, how AI can contribute to improving health
Mm.
outcomes, but also improving access to healthcare.
Okay, Dr. Reddy, and touching upon that, the education aspect of it. Now, as this world we transition to Industry 5.0, now how do you envision this shift shaping the future of higher education, and what unique roles do you think universities will play in preparing students for a human-centered but AI-driven workforce?
I think, since we have had the release of ChatGPT to the public, and it's been only 2 years, it's
Mm,
really taken the higher education sector by storm.
yes.
Now we have many more large language models beyond ChatGPT, but a lot of generative AI applications in other areas, video generation, image generation, audio generation, and so forth. And then there is the traditional AI applications, machine learning applications. I've been involved with AI for more than a decade now in various forms. So I've seen the journey of AI from being people being skeptical about AI now wanting to embrace AI. But within the academia itself, it's become a challenge to an extent because we are starting to see students utilize generative AI for their assessments, but
Mm,
also there is the opportunity side of things where tutors and educators can utilize generative AI for curriculum design, for content development, and for various other purposes. So, from that point of view, AI is very important now to the higher education sector. Here in Australia, pretty much nearly all universities are either preparing a policy around utilization of generative AI or are on the path to uh, prepare one or release one. So
mm.
I think it's a good sign that universities are seeing the opportunity in using AI, Gen AI, but also setting down policies for students such that they use AI ethically and effectively.
So very well said, Dr. Reddy. Uh, uh, for universities, and AI in education is a great boon in many aspects, but at the end of the day, we need to look at it as more of a tool rather than a replacement for our minds, especially that for our students, right? Um, and which is why critical thinking a critical way of understanding things is so much more important now than ever. And I think that's been echoed across experts in academia and also both in industry. So, look, Dr. Reddy, thank you so much for your time today and sharing your incredible journey and insights with us. Your passion for leveraging AI to improve access and also to improve healthcare itself is truly very inspiring. And we're excited to see the continued impact of your work. Now, to our viewers, thank you for joining with us today. For more about Dr. Reddy's work and ExpertGate's mission to create a better future for everyone, visit expertgate.org. This has been ExpertGate for everyone, everywhere.